After about 2 months, adult use marijuana sales resumed on Monday. But with an eye on stopping the spread of the new coronavirus, there are health and safety restrictions for both employers, employees, and customers. I spoke with Steve Reilly, co-founder of INSA, which has a site in East Hampton, to learn more.
I think the governor has to make difficult decisions in terms of which industries he's going to select to open. And then, once he makes that decision, obviously there are specific plans that have to be implemented for every industry to open safely. So I think that between the governor's office and the CCC, they've put together as reasonable a plan as possible. I think that the Cannabis Control Commission has been excellent to deal with in terms of working with us on putting together a plan. Every operator has a unique site, and I think that they've, to date, at least for our facilities, have recognized that and have been flexible in terms of operations that work at each site.
What has reopening meant for you in terms of altering things at the location in East Hampton, which has both adult use and medical, right?
Yeah, so basically what it means is creating up a sales setup outside, essentially, so that we can do these transactions outdoors. So we've submitted a plan to the CCC that was approved. But in terms of infrastructure, there's quite a lot that has to be put in place in the back of the house. And then also what people see forward facing at the front of the house when they show up, that's not going to be the same experience that they had previously. We really have to just kind of pay attention to the nuts and bolts of the operation, keeping the social distancing, making sure that orders are there and we get people in and out quickly. So we like to have a really great service model, and we do as best as we can with that now, but it's a little harder to do with these existing operations and the environment we have to operate in.
Currently, as I understand it, jumped on the website this morning to see what was going on. You are doing online ordering, not phone orders, correct?
Yeah, and that's a perfect example. So we're going to get back to doing the phone orders. It was just, at the commencement of this, we didn't want to take on too much, and we wanted to be able to be responsive to people that were placing those online orders and, having any kind of issues or anything like that. So we expect that we'll start doing the telephone calls again now that we've got our feet under us, probably within a few more days, I would suspect.
What has demand been like from customers who haven't had access to legalized adult use marijuana in a couple of months now?
It's been high, and what we've seen is a higher ticket. And I'm not sure if that's people kind of speculating that, they haven't had a chance to purchase or they might not in the future. So we've seen a higher ticket number. In terms of volume of customers, we've seen a pretty significant volume. I don't know that I would say it was the same as when we first opened in East Hampton back in December of 2018, but it's a pretty high volume. Our system allows us to kind of regulate how many people may come in by how many online orders we'll allow. So we've been kind of adjusting that periodically just to try to get the right fit in terms of being able to provide products to customers, but then also being able to handle the traffic.
When you say ticket number, you mean amount of money that's spent per customer per order?
Yeah, exactly. Yep.
So roughly, give us a sense.
So we've probably seen closer to $20, $30 extra on the average. So if the average ticket, say, is $80, we're closer to about $110. And then it differs from site to site as well.
Wow, so that's a big jump. Are you worried about running out of product?
We've had some limits on flower, but we're hopefully going to be lifting those limits going forward. At the initial opening, we wanted to make sure that we could accommodate as many consumers as possible and give them a reasonable amount of product to buy. But as we're readjusting based on the demand that we're seeing, hopefully we're going to be lifting those limits as well.
Earlier in our conversation, you made reference to back of house, which is sort of the behind the scenes where the employees would be working, right? People who are coming in as customers might not be seeing that on a day-to-day basis. But can you tell us what changes you've made back there to make sure that your employees are socially distanced, taking those safety precautions that the state has said are necessary to be open, and just what you're doing to keep your employees safe right now?
Yeah, and it depends on which operations we're talking about, retail versus, say, cultivation, but we're trying to stagger shifts. We're creating separation for anybody that's in a station. Obviously, the cleanings, the masks, all those requirements that the state has, we're complying with. So we're doing the best that we can with it. We've installed plexiglass wherever we can, either between employees or between patients as well and patrons.
When the state made the decision that adult use marijuana was non-essential, INSA came out with some other marijuana companies in the region and said, you might have to furlough, you might have to lay off. You did, in fact, move forward with those layoffs and those furloughs. Are you able to bring people back? And if so, how many?
We have. I don't have the exact number, but we've brought back a significant amount. We've had some difficulty in doing that. I think there are some employees that are probably doing better with some of the benefit programs for COVID-19. But I'd say for the most part, the employees have been willing to come back, and I think have been happy to be back. So it's been a good environment to be in. Doing
better, you mean making more money on unemployment than they were as paid employees?
Yeah, I think that there's some of that, a little of that, but we've seen pretty good retention in terms of the employees we've called back wanting to come back.
Can you talk about the impact that this has had financially for the company?
Yeah, a little bit. The adult use sales were probably around 95% of our gross revenue. So obviously that's a large hit, and we've had to significantly readjust the business based upon what we can afford to do. So we've had to change operations significantly. In addition to that, we've had a lot of out-of-pocket expenses to be able to set up this curbside pickup. We've got police details and other things like that now. So those factor in as well.
Those police details, is it sort of akin to what you needed when you opened?
Yeah, pretty much the same thing. And the way we looked at it was to say, let's be safe about it. We'll have the details. We'll start with the details, see how things go. And then if it doesn't make sense, we can always back off of that later. But I'd rather be prepared for that and then make a decision later that we don't seem to need it. But we're fortunate that we're in two communities in Salem and East Hampton with adult use. We've got great chiefs and great mayors that are really flexible in terms of how these operations run. And they've been very fair to deal with in terms of requiring details and when they require them, that sort of thing.
Speaking of being safe, with all of this online ordering now, how are you assuring that the people who are purchasing the product are of legal age?
Everybody's being checked, so we have the same the same identification systems that we've had. So we have outdoor handheld bear scans, and then we also have ID checks at the point of sale.
When the state decided to consider recreational marijuana of non-essential status, did you see an uptick in people on the medicinal side? Did people just go out, get their medical cards, and come in the door that way?
Yeah, we did. I think the CCC released some numbers that said they were around like 18% increases. And I would say that's pretty consistent with what we saw. We saw a lot of new faces, particularly at our medical dispensary in Springfield.
Do you think that this pushed anybody to the black market? Maybe they weren't able to get that medical card, but still wanted access to marijuana in the last couple of months.
I'm sure it did. I mean, there are people that don't get cards for a number of different reasons, and I don't know that was going to change. Those reasons were going to change with COVID-19. So for any of those people that would use that product to regulate themselves medicinally, they wouldn't have a venue to purchase it other than the black market. So I would suspect that they did.
Given that you had kind of a 2-month pause, and I know that the marijuana industry challenged the governor's decision to stop those sales, you didn't win on that challenge. Did the time off give you an opportunity to either rethink process or develop more products? Was there anything good that came of it?
I did have an opportunity to redevelop some processes here. We weren't part of that lawsuit. It was, I think there were 3 or 4 companies. We didn't feel that was an appropriate thing to do, so we were not involved in it. But we did try to work on everything we could with the downtime. Some of the difficulty was preparing for how will we open when we can reopen, because those plans and those processes are a significant amount of work to be able to put them in place.
What do you think the new normal is going to look like? Are you going to go back to what people expected, what it looked like when you first opened, or is it going to be just totally different?
That's probably a question for the governor and for the legislature. But I mean, the way we look at it as, we're going to continue to plan to operate in this manner for the foreseeable future until we hear otherwise. This is going to be the model. I think it becomes more difficult probably as the weather turns. I think it's fortunate right now that we're coming into some good summer months, so things like curbside pickup are a lot more feasible. If this was happening in January or February with snowbanks and bad weather, it'd be far more difficult.